you, Tony, for having me once again. So first things first, let me introduce myself. Tony has done a fair job of introducing me. My name is Dr. Adeniyi Osamiluyi, medical doctor, but most of my work in the last 15 years has been in digital health, leveraging technology to increase access to quality care in Nigeria and across Africa. So we founded a company called Premier Medical Systems about 11 years ago. One of the Premier Medical Systems then went on to build DockyLink, which is a community of doctors. I'll come to that later. But again, the topic, what I'm supposed to be talking about, and what indeed I will try to talk about, is talking about healthcare in Africa. It's difficult right now to talk about healthcare and indeed almost anything without talking about COVID. So talking about healthcare in the context of COVID across Africa, I think a good thing, first of all, is to try to say, what was the landscape like pre-COVID? So before COVID came to Africa, or before we had the first case of COVID in Africa, what were the issues? What were the conversations around? So key conversations in Africa before COVID came was universal health coverage. The conversation was, how can everyone be able to access care, be able to walk into an hospital? How can we remove the inequities in healthcare? That was a key conversation in Africa, universal health coverage. Another key conversation was the gaps in healthcare funding. That was well documented. What resources, what funding was government committing to healthcare? And that led to calls for involvement, because of course there were huge gaps, or there are huge gaps in funding of healthcare. That led to calls for bringing in the private sector to support the funding of healthcare, because it was realized, even though government gathered in Abuja in 2001, which is called the Abuja Declaration, and said 15% of our budgets should be for healthcare. And we found in Nigeria, for example, budget is around 5%. Budget for healthcare is around 5% of the whole budget. So clear gaps in funding of healthcare, and that made it important to bring the private sector. So we now talked about PPPs. So PPPs was a conversation in healthcare across Africa, from Kenya to South Africa, and indeed Nigeria, for private sector to help to be involved in infrastructure, equipment, etc. Another key conversation in Africa was communicable diseases. That has always been an issue in Africa. Communicable diseases like malaria, like tuberculosis, like HIV. Those were things, conversations around in Africa. But beyond just saying communicable disease, another conversation that was key in Africa was we were beginning to see an increase in non-communicable diseases. So non-communicable diseases like diabetes, non-communicable diseases like hypertension, cancers, they appeared. And indeed, they were increasing. The incidence was increasing in Africa. So that was also a major conversation. Studies found that this might not be unconnected with changes in lifestyle, the food that we eat and things like that, rural, urban migration and things like that. So that was also a key conversation, and saying that the disease burden in Africa, when you talk about non-communicable diseases, what was going on. Another key conversation was in terms of shortage of healthcare workers. So you had Africa with just about 1.4% of healthcare workers globally, saddled with 25% of disease burden. So these were conversations that were going on around Africa, and that was what pretty much pre-COVID. But again, one key positive that I think we've has been examined as part of the experiences that we had in Africa that may have contributed, or that may indeed be contributing to how we are coping. Okay, so that can be a subject of argument about how well Africa is doing in terms of COVID. But again, Africa entered the COVID era, so to speak, with an experience in managing Ebola. So we had Ebola in outbreaks in Congo, in various parts of Central Africa, and indeed we had also had Ebola, although there was just one case in Nigeria. And so Africa entered, if you like to use that word, or COVID entered Africa, with Africa having some experience in terms of managing outbreaks, Ebola outbreaks. So COVID came. First case diagnosed in Africa, Egypt, 14th of February. And after that, Nigeria, where I live and where I am speaking from, 27th of February, just about 2 weeks later, the first case was diagnosed. And but today we're talking about across Africa over 800,000 cases across Africa. Today we're talking about over 15,000 deaths across Africa. So COVID came with the background in terms of the health systems and things like that. COVID came and led in a way to disruption of provision of healthcare services. COVID came and led to disruption in terms of healthcare utilization. And so there are ways that I feel, yes, and I will highlight one or two that COVID may have brought out, if you like, the best in us. But again, without a doubt, COVID led to disruptions. First of all, facilities, centers, some centers were dedicated to as COVID centers. So again, people couldn't access care in those centers. Beyond that, healthcare workers themselves, there was reallocation of resources. So some healthcare workers had to be dedicated as COVID warriors, as frontline healthcare workers for COVID. So again, beyond that, because of the lack of PPEs and other necessary infection prevention equipment or materials, at times doctors were reluctant to see patients, and you can't, of course, blame them, because if you can't protect, if you don't have adequate materials and things as little as face masks, surgical face masks, and things like that, how would you be able to see patients? So there was disruption in supply chain, and these were things that happened that were caused by COVID. But something that I describe, you may look at it maybe as an advantage, I don't know, but because when COVID came, borders were closed, there were flight restrictions, there were events were cancelled, etc., like that. We found that normally people so medical tourism, even for cases that potentially could be handled within the country, was very, very common. Within the continent was very common. So COVID led to people trying to look inwards to say, how can we access care locally? So I've always felt there's an imbalance. So across the continent, we talk about shortage of doctors and things like that. That is true. That is clear. However, you find that even at times, the doctors, the specialists that are available, that are on ground, there's low capacity utilization, and this is not often highlighted. So you find out that even for specialists, they don't see as many patients as they should. But because, of course, restrictions in travel, international travel has been cancelled, at least in the meantime, people had to seek care locally. And again, that also led to hospitals investing in infrastructure because, of course, they were able to see more people and things like that. So those are part of the things that, of course, again, government, they had no choice. With the support of the private sector, they had no choice to, although again, you can look at it as an emergency response. But again, they had no choice with the support of the private sector to make healthcare a priority. So people talk about the post-COVID era. Talk about the post-COVID era. I, when you look at the way things are, I keep wondering, will we have a post-COVID era? I think we should talk about the flattening of the curve. Maybe we should talk about when a vaccine is found. I think it is too early to talk about a post-COVID era because again, you look at in a lot of countries, local flights have been are now being allowed, right? But you would observe that, and when you interact with people, the attitude of people has changed in terms of air travel. Not everybody is as keen to travel. So, and this cuts across various sectors. So I think it's important when we have these conversations, should we, so it's people talk about the new normal. I think new normal is better than when we talk about post-COVID. We don't know how long that will be for. So another, if you like, good thing, and this is something that is close to my heart, it's the domain where I work, because of course there were disruptions in healthcare delivery across the world. That led to people turning to telemedicine, people turning to alternative ways of accessing care, doctors turning to alternative ways of delivering care. So telemedicine could be just picking up the phone, a phone call. So I knew COVID again pushed even people that were traditionally slow when it comes to embracing innovation, such as I knew public hospitals that issued phone numbers and said people, whether this was driven by the management or driven by the doctors, I knew public hospitals that issued phone numbers and said if you wanted to contact them, you didn't have to come. So as it doesn't have to be techie, you're going, whether it's AI or stuff and things like that before it's telemedicine. So as little as low-level stuff like that, phone numbers were provided, and patients that had their surgery cancelled, they had their follow-up cancelled, so appointments were cancelled. People that had surgeries that were supposed to have follow-up care, they couldn't in the hospital. So telemedicine came in. So again, we may begin to argue about to what extent as telemedicine, as COVID led to the adoption of telemedicine. Without a doubt, there is greater adoption. But if we want to play with numbers, we can say there has been 500% increase. But again, because if you have from 1 to 5, it's 500% increase. So what I'm actually saying is that yes, there's been an increase, but it's not where we should be. For example, I was reading, I think Teladoc in the US had about 2.5 million virtual consults in the last quarter. So in Africa, yes, there's an increase, but if we want to make things sound exciting, we'll tell you there has been 500%. Yes, it could be 500%, but again, in absolute, a lot of frictions, a lot of barriers, a lot of challenges. On the consumer side, confidence, again, link it back to universal health coverage, because most consumers have to pay out of pocket, so affordability is an issue and things like that. But again, with time, there's been progress, and potentially those frictions, those challenges will be surmounted. Finally, a little bit more about the work that I do. So I run DocuLink. DocuLink started pretty much, it came from a problem that I had myself practicing as a medical doctor a couple of years back. So DocuLink essentially connecting doctors. But we've grown in terms of our doctors on the platform. Most of our work right now, beyond the connecting of doctors and the communication and the exchanges between doctors, is connecting consumers to doctors. And I usually like to highlight, so there are telemedicine platforms that do a lot of things like primary care across Africa. But DocuLink is more of specialist care. So if you're looking for a dermatologist, and dermatology is an area that we have actually seen an increase in people trying to connect with doctors, both virtually and hospital visits. So we've seen a lot of people trying to connect with dermatologists on our platform, having virtual consults. We've also seen with other specialties, whether it's the cardiologist, endocrinologist, but we've seen a lot, I think, probably because of the, in quote, visual nature of dermatology. Maybe that has seen a lot of consumers embracing this. So we play mainly trying because we have a lot of quite a few specialists, whether it's neurosurgeons, neurologists, and things like that, specialists on our platform, and we connect them with consumers. So I'll stop here. I'm happy to take having me here. We hope next year, God's grace, we will be able to share absolute numbers, absolute numbers, exciting absolute numbers, and not just averages or percentages. But definitely, there's progress in terms of adoption of technology and telemedicine across Africa. Thank you once again, Tony.
Oh, Dr. Nii, thank you so much. We do have a question for you, but before then, I also want to ask if I should make you a host to share your slides, or should we just send your slides out to the attendees? Which one do you prefer?
Yeah, so pretty much, like I had like maybe 3 or 4 slides. I've really spoken to much more, most of what I have. So I think for anyone listening, I've shared pretty much what was on the slides. Thank you.
Yes, one thing we would also like to call out here is that from a contact, because you're speaking now, many people may want to connect with you or DocuLink. Please, if you're on the platform, Dr. Nii is actually on the platform. If you have specific business opportunities that you want to explore in the healthcare space, do check out his information. You can DM him, or also if you're on Zoom, please do reach out. But we do have a question from Dr. Femi Oshidele. He says, Dr. Nii, I appreciate you mentioning the emergencies that COVID has revealed across the continent. Could you expand on strategies for leveraging these opportunities to advance healthcare throughout Africa?
So, like I said, first of all, so there's no longer a hiding place. The former Honorable Minister of Health, they're in meetings, you know, when you're in the cabinet meetings, you are trying to justify why healthcare should be funded. You know, so you're the Minister of Health, you say there's a reason why people should be funded for, why healthcare, why your ministry should be funded. So you have the Minister of Finance, Minister for Housing, Minister for Works, etc., all trying to justify. So when he says yes, healthcare, people say yes. When they make roads, people are also, you know, they get to hospitals on time and things like that. So it was at times difficult because people say, okay, this Ministry of Environment also has to be funded because environment is also about your health and things like that. But I think with COVID, healthcare is now in the front burner. And I think that's something that is key. There's no hiding place for governments. They realize in terms of the weaknesses in the health system, and they realize they need to fund healthcare, the healthcare sector. That's one in terms of of government, funding for government. Again, I think across Africa, COVID again has provided opportunities in terms of the private sector. They see opportunities. For example, I think last week, if there was a commissioning of a face mask producing factory. So the business case has always been there, but I think it's now more obvious in terms of investing in healthcare, attracting funding to healthcare, in terms of we can't depend pretty much on Asia for equipment, for consumables. We've seen what can happen. So there's greater business cases, or more. It's easier in quotes to attract funding for healthcare. Also, government hospitals. Pre-COVID, yes, that was the case, but again, it appears to be increased in terms of PPPs. Hospitals, even government hospitals, partnering with private sector, whereby their labs, whether it's their CT scan, they don't have a CT scan, the private sector is bringing in the CT scan, the private sector is bringing the MRI, and the government, the public hospital brings the patients. Of course, they have got the patient, but of course, they weren't providing care as well as they should. So the private sector comes, and you have many examples of this across the continent. So those are ways, I think, which then of course technology, which is the area that I play. There's a lot of interest, a lot of technology startups are attracting funding in terms of what they are doing, in terms of electronic medical records, in terms of all the things that. So pretty much summary, COVID has brought the spotlight. It's not. It probably wasn't the best way for this to happen, but without a doubt, COVID has brought the spotlight on health, and it's relatively easier to attract funding and for healthcare projects across Africa. Thank you.
Wow. So I want to one last question, but it's going to come from me. From an investor. So if an investor is looking at healthcare across Africa, they might be thinking, oh, can Africans afford, can Africans afford it? Should we build that hospital? Should we bring those equipment? Should we bring this sophisticated solution to Africa? If they were asking you that question, sir, what would your answer be?
Okay, so it's interesting that, so this again, I will go back to something that was said by someone said, I think it's the head of NSCIA for Nigeria, and I don't remember his name right now. They invested in a cancer center in Nigeria, and this was something that he said to governments. Government was like, they are investing, they're partnering with a public hospital to build, I think, the largest cancer. That center has been built now, has been commissioned. They built the largest cancer center in West Africa. And part of the question that they were asked by governments, by the leadership was, will people be able to afford this? And he practically told them, as governments, that is your business. You need to fix universal health coverage, make healthcare accessible to all people. However, beyond making it accessible, available to everybody, there are also people right now that are going, for example, in Nigeria, going to Ghana, going to Asia, India, to access some of this care. So there's a business case for it. You need to invest in this infrastructure. You need to invest in this equipment, make it available. One, there are people already going outside that can afford it, that because it is not readily available, they're going outside the country to be able to access this care. In terms of people that are below the poverty line, it is you, the government, so that was how we had the conversation. You need to fix those frictions. You need to, universal health coverage shouldn't is not negotiable. We've been stuck on 5% in Nigeria for a while. So those are things that need to practically be solved. So to summarize, yes, ability to pay is there, and investment has to flow into those spaces and those critical healthcare infrastructure. Thank you, Tony.
Wow. Thank you so much. I know we could go on and on, even just this topic by itself. I know there will be questions around, people that might want to reach you. Again, we'll put the information of our speakers out there. If you go to our website, their information is out there. Like I said, if you're just joining us, this is how I started the event, to say each of our speakers are people I consider gatekeepers, and they have keys to the cities, and they are key stakeholders in advancing investments and trade across the continent. So if you're interested in healthcare, for sure, he can help drive that. So thank you so much. We're staying on time.
Thank you.
Thank you. I appreciate that.
Thank you.
We're giving you the virtual clap.
Thank you so much. Thank you so much for having me.
Thank you,
Have a good one.
Thank you. So we're moving on. It's 9:30 right now in Central Time. And I know it's getting later in the rest of the world. Again, we're working on various time zones. We have speakers from Morocco. We've had 2 speakers from Lagos. Now we're shifting to Cairo, Egypt, where we're having representation from the African Export-Import Bank, one of our key sponsors. They were a sponsor last year, and we're so happy to feature them and to also feature the Intra-African Trade Fair,